Have you been just told that you've got high cholesterol levels and you need to do something about it? Or is it someone else in your family who needs a bit of a help with regards to their cholesterol control? Have you been just started on statins and these are the drugs that are used for cholesterol control? Or you're just worried about the health of your heart and want to know about how you can control your cholesterol? So you've come to the right place, and what I'll try to do is to summarize the top 5 tips that you could use to control your cholesterol better, and these are all without using any medications. By the way, these are all backed up by scientific evidence and recommended by Mayo Clinic. For those who don't know me, my name is Dr. Shoaib and I work in medicine and nephrology at Cambridge University Hospital. Before we know more about cholesterol, please press that subscribe button down there and that little bell icon down there as well, so that you're the first person to know about my future videos about topics such as these. The first top tip: eat healthy foods. So what do I mean by that? So there are different types of fats that are usually consumed by us in our daily diet. The saturated fats and the trans fats are the bad kind of fats that are usually not recommended, and avoiding them basically goes a long way in controlling your cholesterol levels. Full fat dairy products, red meat are some of the common examples for saturated fats. What they do is basically they increase your LDL levels in your blood, which are essentially the bad cholesterol level in your blood, which is basically going to cause more cardiovascular problems or heart-related problems in the future. Crackers, cakes, and margarines, they usually contain another kind of fat, and they are called trans fats. And again, these are considered to be the bad kind of fats which you're trying to avoid. Salmon, mackerel, herring, and walnuts are some of the example of food items that contains the good kind of fat. And by that I mean omega-3 fatty acids, which not only help with your cholesterol control, but they're also very helpful in a good blood pressure control as well. Some studies have proven that whey protein, which can be found in dairy items and not the ones which are full fat dairy items as mentioned before. So having whey in your food is also going to be a very helpful thing when it comes to the cholesterol control. Tip number 2, exercise. Now it goes without saying that exercising goes a long way to burn the extra fat that you've got in your body. But how frequent and how much? Now usually it's recommended that you should do at least 30 minutes to 45 minutes exercise every day for at least 5 days a week. Now you can do that if you are biking to your work, so that's one of the better ways of incorporating that exercise into your daily routine. Or you could basically brisk walk to work if you happen to be living near to your workplace. Or alternatively, you could find a certain time in your day where you could actually do this brisk walking in a given provided environment. Playing a sport that you really like, especially with a friend or a buddy, is another way you could actually try to incorporate that exercise into your daily routine. Tip number 3, which I think is one of the most important tips, is to quit smoking. So if you happen to be one of the smokers, my number 1 recommendation to you is please stop smoking. It's been proven that within 20 minutes of stopping smoking, your heart rate and essentially your blood pressure returns back to normal. Within 3 months of stopping to smoke, your lung circulation and your lung function tests usually return back to normal. And within 1 year of stopping to smoke, the risk, the cardiovascular risk, which is basically the risk to your heart and heart function, is basically halved when compared to someone who is actively smoking. So you can do yourself a huge deal of favor if you can just stop smoking. Number 4, lose weight. Now there are 2 ways you could achieve that. Number 1 is basically by controlling your diet, and number 2 is by increasing your activity. Now how can you control your diet is basically making the right choices. So I don't usually recommend patients to enforce a certain choice on them. What they need to basically do is to make the choice among the food items that they've got in front of them. So basically, if they've got a sweet beverage in front of them and they have got a tap water as the alternative option, which all of us have actually, they should try to go for the tap water. In the same way, if they've got chocolates in front of them and at the same time they've got an option of having popcorns while they are watching a movie, well, they can and they should actually go for the popcorns. Sherbets and candies with essentially no fat and sugar-free are another set of choices that they can make, which is basically going to improve their cholesterol control. The second way is to incorporate more activity in your daily living. Taking stairs, taking walk breaks, and cooking if you can. All of these are going to burn more calories and essentially help with your cholesterol control as well. And tip number 5 is to limit your alcohol intake. And I think the key thing here is to limit rather than completely stopping the alcohol intake. So for those who don't take alcohol, it's not been study proven that taking alcohol actually helps with your HDL, which is a common misconception. So if you don't take any alcohol, please stay away from it. But if you are taking alcohol, then only drinking in moderation is proven to some extent that it could actually improve your good cholesterol levels, which is the HDL. The definition of moderation is usually limited to about 1 drink a day if you take alcohol regularly, less ideally if possible. Now, in some literatures, if you're a man under 65, you can take up to 2 drinks a day, but trying to limit to 1 is always going to be a better option. And these lifestyle changes are only a start. You got to keep at it and basically be consistent with these. Only then they're going to make a huge difference. And these differences or these changes are only additive. So do expect the changes in your body to appear within months to years rather than a few weeks, to be honest. Now, if you already have a cholesterol problem and you've been diagnosed to have one, then I think the best thing you could do is to follow these 5 tips, as they've been backed up by scientific evidence and they can never go wrong. But at the same time, make sure that you remain in contact with your doctor, as he or she is the first source of information and management for you. And also because every case is different when it comes to patients. So your case might be completely or entirely different from someone else who is essentially diagnosed as having hypercholesteremia, such as yourself. So make sure that you remain in contact with your doctors. If you have any more questions about this topic or any of the topics that I've talked about in the past, please feel free to write in the comment section down there. Thank you so much for joining me. Don't forget to please press the subscribe button and that bell icon down there. And I will see you again with another one of these videos. Until then, take care of yourself and Allah Hafiz.